As usual, I can say as we are ready, and we are ready to combat this disease because that's our core duty with also other health professionals. But our readiness should also be complemented with what it takes to treat this disease. And this takes me still to the issue of equipping us with the right, adequate personal protective gears, which is still an issue as we talk today.
It is an issue, yes, of course, and it's a concern for many Kenyans because already we are below the threshold as required by the World Health Organization because we are short of that by about 72,000 nurses to hit the required about 130,000 plus. Is that a supplementing problem to the already existing problem in the country?
As of now, we have about 30,000 nurses in employment. We have about 20,000 in the public sector and about 10,000 in the private sector. So if you compare that to the number and of PPEs that have been supplied, there's a very, very big variation. And that's why we are saying that if you want us to be effective insofar as combating the disease at the front line, give us the right artillery. Don't send a soldier to the battlefront without a gun or a bullet. That doesn't make sense.
And what has been the response of the government when you reached out, or the key stakeholders in this regard, of course, the government agencies, in regard to the shortage you experience in terms of the personnel, protective equipment, the PPEs? What has been the response?
We understand because we are also human and we live in a global village. We understand the global challenge that all nations are actually experiencing. But we want our government to demonstrate that actually something that we can put our finger on is being done. That these are the number of PPEs that we have supplied to Mandera. These are the number of PPEs we have supplied to Bungoma. These are the number of PPEs we have supplied to Kisumu. We should start getting the statistics, the real number of PPEs which have been supplied to these areas and counties. That will help us now understand as of what is the shortage, how much do we need, and things like that. But just telling us that PPEs have gone to the health workers, how many are they? And are they the right standard?
And given what has been happening then ever since the weekend, and of course when we saw the shipping in of equipment numbering up to thousands, of course the government says will be deployed and will help the frontline workers. Do you think that will not help in your regard? And are you still skeptical about the government's move in regard to protecting the frontline workers who are the healthcare workers in the country?
How do we even get skeptical or reassured on something we've not seen? That is why I'm emphasizing, let us see those PPEs being received at the airport and coming from the airport, maybe probably going to whether it's KEMSA or the warehouses, and then from there, they go to the users. And then it is demonstrated that it has come from the airport to KEMSA and to the users. Let us not just receive them, but demonstrate that they have reached the users at the right place.
Okay, and given that, of course, we already are in a state where our infrastructure in terms of the healthcare capacity of the country is wanting. We are there's deficit in terms of the equipment, shortage in essential drugs across hospitals in the country. And there appears further, which is the main problem here, and it's more significant for the Kenyan Mwananchi, the collective lack of endeavor from the nurses union and the government. What happens then in the midst of this pandemic? Why the divisions? Where is the uniform voice for you to attend to the pandemic and address these issues which are underlying later when the dust settles on COVID-19?
You know, it's I can say it's fortunate, or it's also unfortunate, but it's fortunate that we have a new cabinet secretary at the helm, the Minister of Health, whom is working very, very hard and has also breathed in some fresh air insofar as leadership is concerned. But it has been baptized by fire. But alongside that, the COVID pandemic has just exposed glaringly the systemic rot that we have in the healthcare delivery system. We need to fix the systems from Afya House up to the lowest echelon of healthcare delivery system. That is what this COVID pandemic actually has exposed, that the systems actually are not aligned. Sometimes you hear the national government saying this, you'll hear the county governments also saying this, and yet we are fighting the same disease and the same enemy. So we will not wish to go into that, but we want to implore on all stakeholders to bring their efforts together so that we have a joint approach, a joint effort to face this one enemy.
And given, to just quote what the Director General of the Ministry of Health, Dr. Patrick Amoth, at one point said that after attending to suspected patients or patients who are positive, the healthcare workers are taken to a center where they are tested and their situation or welfare is guaranteed. Then we had Seth Panyako, the Secretary General of the Kenya National Union of Nurses in the country, who said that's not the real picture on ground. There appears to be no compelling, clear and consistent channel of communication between the union and the government. Who does the Kenyan Mwananchi get the information from? At what source?
You don't expect my brother Seth Panyako to talk about what he has not seen. And you don't expect the nurses on the ground to give us feedback on what they have not seen, either me or Panyako. So they'll only tell us what they can demonstrate that is truthful. So that's why I'm still imploring to the government, as you make that statement, can it come with straight face, or this is our workers once they come from this clinical environment where they're in direct contact with the COVID-19 patients, demonstrate in practice, not just in speech, so that we can all see. And actually, as the famous saying says, seeing is what? Is believing.
So, and in raising the concern, of course, there's a legitimate ground for you to call for personal protective equipment, which are very important, very paramount, even as you stay at the front line. But how does the government then ensure that you, the nurses who are at the forefront, do not become patients? What are the safeguards here, the guarantees and the assurances that the healthcare workers also do not infect their families who they go to in the evening after attending to their cardinal responsibility?
The guidelines are so simple and they're there. Just like we enforce the guidelines of curfew and so on and so forth, and putting on mask for every person who is in contact with the community. The guidelines insofar as handling the health workers is also very clear and it's there. That is why we need to enforce it equally. We know, and I've always repeated this, let us borrow the best practices from the nations who have recovered from this pandemic. Let us borrow the best practices, how they used to handle their health workers. Let us not borrow the bad practices, but the good practices. How did China attend to their nurses, to their doctors, to their clinicians? How did they safeguard them so that they have minimum loss of the healthcare workers? You cannot expect a healthcare worker who has attended a COVID-19, who has tested positive in a clinical environment, to mingle freely with the community. Even what is happening in the places where they have been managed to contain it is that there are special accommodation arrangement that has been arranged so that you come and you also prepare to prepare your family too, that for this length of time, I may be in such a place that I'll not be with you. So these are things that can be enhanced just by simple communication techniques.
Okay,
and demonstration that.
Yes, go ahead, please.
And demonstration that if I say today, as a government official, that we have set aside such and such a place for nurses who are working in Bagadi or KNHIDUs to go, let it be demonstrated. That's what I'm insisting. Let it be demonstrated with evidence.
All right, but there are, of course, best practice examples that Kenya can copy from or lessons from the top that Kenya can epitomize. But it's unfortunate you cite China, where the President Xi Jinping's government put in isolation the doctor who first raised the alarm on COVID-19 in the city of Wuhan in Hubei province. He later died of the virus. The government accused by the UN agencies of using lies, cover-ups and repressions in response to COVID-19, not reporting the actual numbers. I mean, what lessons can you learn from China in containing the virus when there has been repression and what appears to have been a censorship on the Chinese media in what the Chinese people see, hear and read?
I have said, my brother, let us not copy the bad ones. We copy the good ones. The bad ones we condemn and we leave it to them.
But what extent of coverage has
cannot
come,
copy the bad
or
one.
have you learned from the Chinese approach in terms of censorship on its media? What has been very practical and true about the exact picture in China on your end that the government can copy?
I'm talking about handling of healthcare workers per se.
But the government mishandled the doctor who first raised the flag on COVID-19, put him in isolation, he died, and there are many healthcare workers who have reportedly died, but that's not reported because of the censorship on the Chinese media.
Those are isolated cases, and we cannot copy that. What I'm saying is specifically, if they happen to have taken the nurses or the doctors and the clinicians who are taking care of the COVID-19 patients to a specific environment as per the WHO guidelines, that is what we should copy. But if they're suppressing them, we can't copy that. We can't.
But the problem
is everything we are doing as per the WHO guidelines and directives.
Okay.
We are not coming out with our own inventions.
Okay, but there is a concern.
It must be standardized, scientific.
All right, but there's a concern also as to the Chinese influence in the UN system and the support they offer as a veto power to the appointment of Dr. Tedros Adhanom Ghebreyesus, and that the World Health Organization failed to term it a pandemic and have been fed by the Chinese media and authorities instead of relying on its office in China, therefore delayed and caused all this global problem, prompting America, which is its biggest funder, to cut resources.
As Kenya and as health workers of Kenya, it may be difficult for us to influence the geopolitics outside there. Very, very difficult. We know the enormous influence that Chinese have, the enormous influence about the resources that are controlling the geopolitics out there. What we must concentrate on is to ensure that our people, our health workers are safe. And we are following the scientific laid down guidelines, which have been tested and verified to safeguard ourselves and manage this pandemic.
Okay.